Hey everybody, welcome back. We're going to be doing a part 2 version of the crutch training video we did a few months back. We did a crutch training video with a young lady demonstrating how to use crutches while also wearing a long leg fiberglass cast. So in the comments and in private messages, we've been asked to do a continuation of that crutch training video demonstrating how to use crutches going up and down stairs. You can use the same thing we're going to talk about in this video on how to go up and down, like say for example the curb at like the grocery store or the mall or such. First things first, if there's any way possible to not have to use stairs with crutches, that is always going to be your first option. Always going to be your first option. If you have access to an escalator or an elevator, or if, for example, if you have a residence and you can make arrangements where you don't have to go upstairs for your sleeping arrangements or your bathing arrangements, and you can do those things downstairs, that is always going to be your first choice. Crutch training on stairs is typically not 100% safe. It is always better to look for other options before going up and down stairs while using crutches. That being said, I definitely want to get that out there first before we go into the actual crutch training up and down the stairs. So that being said, I have myself and I have another individual with me. We're going to do the initial demo because I want the people watching this training video to know that I would never ask the people watching to do something that I wouldn't do myself first. And so that I want you to know that it is an actual proven method. So it's not just something I'm putting out there for viewers and saying, hey, do this, without showing you that it actually can be done by the person asking you to do it. So that being said, we're going to pause for just a second. We're going to get everything set up here on the stairwell. We're using a stairwell outside of our clinic just because there's a very large amount of stairs right here that we can practice on. So we're going to go ahead and switch angles and we're going to go right into it. So as we talked about in the initial video, the initial crutch training video, always want to make sure first things first before we even start going into this different kind of training, proper measurement. You always want to make sure that you have at least a 10 to 12 degree bend in the elbow where your hand is placed on the pad. Mine's a little bit longer. This is actually measured out for the person that we're going to be using as the patient. And you want to have 2 to 3 fingers space between the axillary space and the pad. So about 2 to 3 fingers gap there. And then remember too that you want to make sure that when they're using the crutches, when you're giving patient instructions, have the crutches out like the letter A as opposed to the letter I. You don't want them to tip over. And you always want them to remember, if you could aim down here, you always want to remember that you want them to take small steps. You don't want to take them big grand steps. You want them to take nice manageable steps with the crutches, the same distance that they would use when they're taking their steps with their shoes, their feet. That's about the same distance you want with the crutches. So imagine taking a normal step and imagine doing the exact same thing with the crutches. Nice, normal steps. Nothing too grand. So that being said, we're going to turn towards the stairs here for a minute, and I'm going to focus on the actual stairs. There is one rule when going up and down stairs. There's one rule, and it's always been the golden rule. Once you've pretty much ruled out all your other options and the stairs are the only way to get to where you're going, either up or down, always remember what they call the good versus bad, or the up versus down rule. And that is, you always go up the stairs. I'm going to put these here for demo. You always go up the stairs with the good foot first. So if this foot is the injured foot and you're coming up to the stairs, you always want to approach the stairs. And as you approach the stairs, you're going to continue with your swing like you already know how to do with the crutches, and you're going to swing to the first step with your good foot first. So we will do that with a little less talking. You're approaching the first step, and approach and go up with the good, commit to lean in, and then follow through with the injured foot in the crutches. Again, you're going to lean just slightly forward, so you kind of have that swing. You're going to lean into the next step with the good foot, and then catch up with the crutches. And you're going to continue to do so. Remember to always go even more slowly than you would normally with crutches. So again, you're going to commit to leaning forward. You commit to leaning forward, bend that good foot so that it can go up to the next step. And then follow through. Now, the saying with this is up with the good, down with the bad. Now, what that specifically means is you always you approach stairs in an upward fashion using the good foot first. And when you're coming down the stairs, you're coming down with the bad, the injured foot first. So up with the good, down with the bad. Besides the fact that applies to just about everything in life, up with the good, down with the bad, up with hope, down with dope. It applies to crutch using. So when you're using the crutches, if you attempt, this is very, very important. This is the most important thing you'll get out of this video. If you attempt to go down any flight of stairs or any curb with your good foot first, you're gonna do irreparable damage. You're gonna do a face plant, you're gonna fall down a flight of stairs, you're gonna injure way more body parts than just your leg. And I'll show you what I'm talking about. I won't go through with it 100%, but I'll demonstrate. If this is your injured foot and it's up in the air, and you try to go down with your good foot first, I'll place this down for balance. But you can see for yourself, if this foot, imagine this foot's up in the air, and you try to go down, you're in limbo right here. You're in limbo. And there's nothing you can do about it other than fall. That's the only thing that's gonna happen, because you cannot reach that. And unless you have ridiculously high armpits, you're gonna wipe out. Every time you're gonna wipe out. So what you do, when you're gonna commit to going down a flight of stairs, and you have no other options, always go down with the crutches and the bad foot first. So again, I'll demonstrate. You go down with the bad, or the crutches in this case, and just a slight lean with the good foot, and you catch up. Down with the crutches, and you catch up. Down with the crutches, and you catch up. And then you proceed on to wherever your destination is, like so. Now we're gonna do that with the patient. Let me step back here. We're gonna do that with a patient so that you can see how we can do all that with a little less talking and the flow of it. So we're gonna go ahead and get set up. We're gonna pause for just like a second or two. Okay, so we've gone ahead and switched around. So we have a patient with an ACE wrap on let's assume a sprained ankle. And we're gonna go ahead and have this patient crutch toward the stairs. They've exercised all their other options. The stairs are the only way to get to the top. So go ahead and, we'll go ahead and watch the patient go ahead and perform like we did during the demo. Stepping up with the good foot, nice and gradually, there's no hurry, stepping up, and then we'll have the patient get repositioned. Easy, easy. There we go. And then we're going to simulate again a sprained ankle. So we're going to have the ankle up, and we're going to have the patient go down with the bad. Nice and gradual, nice and slow. Stepping down and catching up with there you go, perfect. Catching up with the good foot, and then they're going to crutch on down to wherever their destination. Now we'll show some variations of that training at this time. So a variation of using the crutches on a stairwell is if the stairwell has handrails, like this stairwell does. And when having the handrails available, it is actually a little bit safer option, believe it or not. And I'm gonna talk to you about that as we go ahead and do the demo here. Go ahead and crutch towards the base of the stairs for me. And you'll notice as you get to the base of the stairs, what you want to do is you want to convert both crutches to the injured side, or the outer side, if you will, because you're going to use the inside rail with the inside hand. In this particular case, it is his left ankle that is injured. So again, we're going to go up with the good, using the crutches. Yeah, bring the crutches out. There you go. There you go. Perfect. Using the handrail and using the crutches. And as you can see, that works really, really nicely. Now we're gonna switch around to going, and now you're gonna see how we would do the same thing coming down the stairs like we did before, coming down with the bad, or down with the, leading with the crutches, if you will, if you wanna say it that way. And then when the patient gets to the base of the stairs, they're gonna convert back to using both crutches, and they're gonna go on their way. So that's how you would do it if you had a handrail available. Now, to be very honest with you, go ahead and put them both in one hand again like you did before. This young man has the ability to hold both pads with one hand. In a real life scenario, and I want to be realistic about this, not everybody has the capability of doing that. Some people have smaller hands. So that being said, if you have to go up the stairs, if you're opting to do the handrail option, you can either A, find a good Samaritan to take the crutch up and down the stairs for you, or B, there is another version of this which I haven't really taught very often, but it's called the T method. Okay. Got it? And the T method goes like so, So this is a way to, if your hand's not large enough to hold both hand pads, this is another option, and it works just fine as long as, of course, the stairwell is not super crowded or super narrow, in which this case it would work perfect for this stairwell. But again, I just want to show you that there is other options. So we'll pause there for just a second. So that pretty much concludes, I guess, what you would call the part 2 of the crutch training video. Again, if you haven't seen part 1, go back a few videos in the library and you'll find one that says how to make a long leg cast, and then that goes into 3 more videos: a long leg cast, how to remove a long leg cast, and also it goes into crutch training. So this will be a continuation of that crutch training to include stairs / curbsides and such. I hope this is helpful, and I hope this meets the requests that were sent over to me as far as how to use crutches up and down stairs. Until the next video, we will see you then. Thank you very much for watching.